Okay, this is gonna be my video for the OHI part 1 for 141. Okay, so I would start off by explaining to the patient. So today I'm gonna paint this pink solution on your teeth. And this is gonna tell me where you might be missing while you're brushing or flossing. I would lay them back, paint it on, sit them back up, well, after I rinse them and have them spit. And then I would do my plaque index calculation. And then I would go to the patient, hold up the mirror, and explain to the patient. So this is the pink stuff I was talking about that I just painted on your teeth. So right here, if you see all these areas of purplish, pink areas, that's just showing me where you might be missing while you're flossing and brushing. So the lighter pink areas are actually like the newer plaque is what we call it. And this can happen right after you eat. Maybe it's been a minute since you brushed, since you're here for a later appointment. Also, the areas of the darker color purple are older areas of plaque. So what plaque is actually what we call biofilm. Biofilm is an accumulation of bacteria that naturally live in your mouth. And it's a very sticky layer, and they form in layers. And these bacteria or the biofilm will stay on your teeth until it is removed, and the way we remove it is through brushing or flossing. Over time, if we do not remove it from brushing or flossing, it actually hardens, or what we call calcifying, and it can turn into what we call calculus, or what you know it as is tartar. Okay, and then after explaining that to them, I would pull up his perio chart. And then previously, while I was probing him, I already explained to him how I'm taking a little measuring stick and I'm going around his teeth, touching his teeth, just take little measurements. So sir, this is your perio charts, what I was doing earlier. So remember how I was telling you I was gonna measure your teeth? Well, these are actually the measurements that I got. Generally, I like to see 3s or lower. So you do have some 3s, but we also have areas of 4s. If you see right here. All right, so if we take a look at your x-rays, where your bone levels are supposed to be, I would like to see them right here. And in your case, I can actually see some of your bone levels actually right here. So they are a little lower than where we would like to see them. So what does this mean? Okay. You pay attention on the chart here. This is what we like to see. So this is a healthy mouth and gums. Right here we have pink gums. They fill in the gaps in between your teeth. They look nice and happy. And right here you see your bone levels. So like on the x-ray I was showing you, this is where you want your bone levels to be. And this is your nice healthy tissue. And that's that measuring stick I was telling you about earlier. And you see your nice happy tissues. Sorry, I can't really breathe with this thing on. Are measuring at that 3 mark that I was telling you about. Now, remember how we were talking about that biofilm? Well, if that biofilm stays on your teeth and you haven't removed it in time, it can cause what we know as gingivitis. So your gums become very, very angry. And you see right here in between your teeth on this picture is that they're red, they're not happy. But luckily with gingivitis, your bone levels are exactly where they need to be. But you have redness and swelling of your gums, and you see how it goes past that 3 mark. So that's how we can see 4 sometimes. Luckily, gingivitis is reversible, but without proper toothbrushing and flossing, and if we don't get that biofilm removed and it stays there, it can turn into what we call periodontitis. Now, periodontitis is a gum disease, and as you can see here, the tissues are still really red and angry and swollen, sorry. But if you look right here on this picture, that is that biofilm that we've been talking about. And these bone levels right here are starting to decrease. So the bone does not like biofilm, it wants to get away from it. So it keeps going down and down and down away from it. And you see here, your tissues are still inflamed and angry, and you see that 3 millimeter mark on that measuring stick I was telling you about. It's actually about a 6 right here in this picture. And I believe this is where you're at today, sir. So what's the big deal? Why should I care? Well, if we do not maintain this, so if you don't come in to your cleanings and your appointments, and if we don't fix your toothbrushing and flossing, you can actually advance to periodontitis. So periodontitis, unlike gingivitis, is not reversible. So once you have it, you have it, but we can maintain it from getting worse, like to this stage. So this is moderate periodontitis. So if you see here, the gums are still very inflamed, they're not happy. They're actually receding because they're going down with your bone. And again, right here, that's that biofilm. So here, the bone is going down even further because the biofilm is going below the gums. And you see right here on the measuring stick that it's at a 6 again. So it's very important that you come back. So periodontitis is actually a disease of the mouth. What happens is, like in this picture, you see how the biofilm has gone below the gum line. Well, actually that biofilm can go below the gum line and into your blood vessels and travel throughout the body. So it can actually cause disease in other areas of your body. So like your heart, it can cause heart disease, Alzheimer's, it can have effect with diabetes, and even kidney disease. So I know you already have history with your family for having hypertension, also known as high blood pressure. So with your periodontitis and your family history of having this disease, you're actually creating more risk for yourself for getting this. And you're already having high blood pressure at our appointment today when I took it. So if we can get your periodontitis under control, hopefully we can help with your blood pressure, but I'm also going to be sending a medical referral with you when we get home. All right.